topic, Violent Injury and Neighborhood Racial and Ethnic Diversity in Oakland, California, by Berezin et al. Berezin and I think one of his other co-authors were students in the Joint Master's Program at Berkeley, and I believe this was their thesis. And the central question of this paper was the relationship between racial residential segregation and violent injury at a neighborhood level. So as we were going over these talks, we realized we kind of had a fetish for maps and geospatial mapping. So this was fascinating to research, to talk about, just because I got a chance to look at the social science literature on racial segregation and health. And there's actually quite a body of research that shows that segregated neighborhoods tend to have poor health. There's fewer articles looking at violence. So basically the authors looked at the trauma registry from the Highland General Hospital, the trauma center that serves all of this neighborhood, from 1998 to the year 2002. Basically, they looked at the injury locations that were in the trauma registry and were able to geocode about 60% of those. And then they linked those addresses with the 2000 census by block group. Then they used a spatial diversity measure, which they adapted for neighborhood block groups. Okay, and they adapted it also to look at multiple different race and ethnicities. A lot of this work looks at just a binary African American versus white, and they made a point to try to integrate the entire population of Oakland, which actually has quite a diverse population of African Americans, Asians, also Hispanics, and whites. And then they regressed the outcome of the violent injuries on this composite diversity score, and then a priori chosen covariates such as age, poverty, and other covariates that might affect this. The strengths of this study is that it really accounts for neighborhoods instead of citywide analysis, and they also account for the multiple racial ethnic groups. The limitations, obviously, are that it was a single study. The definition of the neighborhood could be up to question, and then they had adapted this measure of diversity, and so they had done some sensitivity analyses looking at other measures, but they acknowledged that this was adapted and a little bit innovative. So as I said before, they were able to geocode about 65% of the injuries. And then they noticed that the increased levels of diversity are associated with low levels of violent injury by block groups. And the association was highest for the African American and Hispanic block groups. And the diversity was not associated with injury for predominantly white or Asian block groups. So for those of you in the room who know Oakland, which I don't terribly much, but if you look at your left-hand side map, this is injuries. The black is more injuries, and the white is few injuries. And then if you lay that on the diversity map, okay, again, diversity is, there's no diversity with the white, and increased diversity with the black. You can see that in the areas of higher diversity, okay, there are lower levels of injury, and in the areas of low diversity, okay, there are higher levels of injuries, except where, okay, the areas are completely homogeneous, right? So the all-white neighborhoods, I think Harrison pointed out Piedmont. I don't know where Piedmont is on this map. They tended not to have increased levels of violent injury. And the authors make a point that these block groups actually had very low levels of injury in general. So the findings might not really correlate. So, basically place and neighborhood is a social determinant of health. And a lot of these neighborhoods follow a legacy of structural racism. There's a lack of a conceptual framework that can really explain these findings. and it leads to a lot of other research opportunities. But it goes to show that the interaction between race, place, and health outcomes is complicated, but really it can inform policy decisions regarding the local neighborhoods that we serve.